Hi, I'm Dr. Jeff Waxman.
And I'm Dr. Kim Lay.
We're pediatric urologists at Baylor, Scott & White in Temple. Pediatric urology is a specialty that focuses on the diagnosis, treatment, and management of urinary and genital problems in children.
We see many common conditions, and one condition we treat is urinary tract infections, or UTIs. These infections can affect the kidneys, bladder, or urethra. We also treat conditions such as hydronephrosis, which involves the enlargement of the tubes which drain urine from the kidneys, as well as vesicoureteral reflux, where urine flows backwards from the bladder into the kidneys.
Additionally, we often address issues like undescended testicles, bedwetting, and hypospadias, which is a birth defect affecting the opening of a boy's urinary channel. A pediatric urologist also manages bladder and kidney stones in children.
We also care for patients with nerve damage affecting the bladder and even see prenatal consultations for urologic conditions diagnosed even before a baby is born.
How are these conditions diagnosed in pediatric urology? There are several ways, but first we always examine our patient. Then we also analyze urine samples. When appropriate, we obtain studies such as an ultrasound, an MRI, or a CT scan, which can provide detailed images of the urinary tract and reproductive organs.
Sometimes we may need to perform a voiding cystourethrogram, or VCUG, or cystoscopy. A VCUG is a special X-ray procedure that helps us visualize the bladder and urethra during urination. This aids in diagnosing urinary reflux or other abnormalities. Cystoscopy involves inserting a thin tube with a camera into the urinary channel to directly examine the bladder and urethra from the inside.
Now, the treatment will depend on the condition. Medications can be prescribed, such as giving antibiotics for urinary infections, or prescribing drugs to manage bedwetting. Surgery is sometimes necessary, such as repairing a hernia, correcting hypospadias, or removing a kidney stone.
We also utilize minimally invasive procedures like laparoscopy.
Let's pick that up. I'll just do a little bit.
We'll just start right there with.
Oh, I'm sorry. So start there again.
Also utilize.
Okay. We also utilize minimally invasive procedures like laparoscopy, robotics, and endoscopy to perform surgeries with smaller incisions, which results in quicker recovery times. In some cases, behavioral modifications, such as lifestyle changes and bladder training techniques, can greatly improve bladder control or manage bedwetting.
And let's not forget the importance of long-term follow-up care. As pediatric urologists, we provide ongoing monitoring and management of chronic conditions to ensure optimal urinary and genital health throughout childhood and adolescence.
Absolutely, Dr. Waxman. It's essential for parents to know that there are specialized experts in pediatric urology who are dedicated to caring for their children's urinary and genital health. Early detection and intervention can often lead to better outcomes, so it's crucial not to delay seeking professional medical advice.
Dr. Lay and I welcome the opportunity to care for your child.